So we've got a painful corn and callus on the apex of the fourth toe here. So it's a really common spot because of the shape of the bone in that distal phalanx of that fourth toe. So it's really quite pointy. So if we claw our toes or wear shoes that are too short, or anything else that causes pressure on the tip of that toe, it'll cause the skin to thicken in this area. So you can actually see that it's got this really hard central section before we even trim anything away. So I know there's a corn in there. And you can see that as the scalpel, as I'm cutting through it here, it's actually stops right on that central section. So you know it's actually harder. So you can actually feel it quite a bit with the scalpel. Now, fortunately, this one's not particularly deep or particularly sharp. So we can actually just debride this one out all in little chunks, piece by piece, and try and get most of it out before we have to use the tip to dig any of that hard corn out. So you can see we're getting quite deep here already, and you see the shape of that toe's already changed there. So we have to be quite careful not to go too far, because of course, if we cut the tip of that toe and then walk on that toe, it becomes very painful. It's like we're walking on a little razor cut. So that's how we debride the apex corn. We need to be really careful as we get right down to the end here. I'll see if I can get this last little section out. And then what we'd do is obviously try and address the pressure issues. So we can use a toe prop, or we can use some sort of silicone sleeve to go over the toe, but anything that will reduce the pressure will help. An insole with a soft forefoot extension will help as well, and also change to shoes that obviously aren't too short, or we're just trying to address exactly what's causing the pressure on the tip of that toe. That's how we actually treat this long term. But short term, we do the following. We just remove the callus and the corn. We'll get the last little section out. There's not much more to come here now. So we remove all of the overlying callus, try and treat this regularly, apply moisturizer, and try and cushion up that area. So we'll see if there's anything left. That looks like it's about it. So we'll take a closer look at that now, and you can see where the little corns come right out of the center. That little dark section is now a hollow. So that's how we remove a corn on the apex of a toe.